Hello, everyone. How are you? Our guest is ready. Let's bring him in now. To everyone joining the stream, a very warm welcome, okay? I should explain, I'm also streaming on YouTube and Instagram, so it'll be saved on both platforms for you, all right? Basically, guys, in just a moment, joining me here on this live stream is the therapist Andre Hercia, one of the biggest names in psychotherapy in all of Brazil. So in just a bit, he'll be joining me on this stream to talk, about paruresis. So this stream is a bit more specialized, right? Of course, those without this condition can learn more about how my treatments work in general, right? The level of complexity I apply to every patient I treat, right? In the same way, the complexity and the meticulousness I use for my paruresis treatments is basically the same as what I use for patients with depression, anxiety, or insecurity, right? The underlying methodology is always the same. The care is always the same, right? So if you don't have this condition, feel free to stay and listen. But if you're joining this stream, whether on YouTube, Instagram, or other platforms, it's likely because you're interested in learning more about this dynamic, right? Last week, I did a stream, which is on my YouTube channel, about paruresis. But today we have this distinguished guest, right? He'll introduce himself shortly, as I said. But basically, Andre Hercia is one of Brazil's top therapists, right? Besides being a psychologist for over 30 years, he's an NLP master trainer and a hypnosis master trainer, right? Currently, I'm actually one of his students in some of the courses he's teaching, right? And at the same time, I'm already one of the few specialists in Latin America for paruresis. So you're in good hands today to learn more about these details, right? Bia's here, Katia, Erica, right? Everyone can take their time joining in. In just a moment, Andre will be joining us to share his insights, right? The goal of this stream, guys, is basically to get a different perspective than mine, Mateus, on paruresis, right? I'll talk a bit more about that in a second. Andre has actually started working with me on 2 patient cases. So I think that currently on YouTube, most of the content on paruresis is mine, basically, right? So it's just my view. So I thought it was really interesting to have a different and very professional perspective today from Andre, who's a great therapist and is also working with me in this area. He'll be joining us right now. So in just a moment, you'll be able to see his screen there. In a bit, right? I think I've already accepted his request to join. Let's see him coming in now. Hey, Andre, a very warm welcome to you. How are you?
I'm good. How are you doing? All good?
All good.
Can you hear me okay? Is everything all right?
Everything's fine.
Perfect. The picture is perfect here too. Andre, you're very welcome already, right?
Thank you.
Here to my Instagram. It's a huge pleasure to have you here, right? The Matthias from 5-6 years ago, when I wasn't even a therapist yet, didn't even dream of it. While listening to those inductions back then, 5-6 years ago, I never imagined that one day I'd be live here with you. So you're very welcome. It's a huge pleasure to really have you here today, being able to, not just with my audience, but with your audience, to be able to present in a different way there. As I was saying just a moment ago, my intention here is to have a different new vision, from your point of view on this problem, right? What we only have here today on my YouTube and all that is my vision. So it's always good to have a different vision. But for those who don't know you yet, I'd like you to introduce yourself a little bit here to the folks.
Thank you, Mateus. I wanted to say that I'm very grateful to be here with you. Call me as many times as you want for us to talk about whatever you want, because I think it's very important for us to have this kind of exchange and for us to be able to bring knowledge to people about topics that are very important, right? Well, I'm a clinical psychologist, graduated many decades ago, more than 35 years ago, that I've been practicing uninterruptedly as a clinical psychologist. And I also learned hypnosis. It was the first thing I learned was hypnosis at about 10, 11 years old. God knows why. Actually, there's a curious fact, Mateus. When my mother was pregnant with me, she lost her grandfather and she got very stressed about it. So her obstetrician was a hypnotherapist. And since she couldn't take anything because of the pregnancy, she was quite far along, already 7 to 8 months. So he was learning, he knew hypnosis and he hypnotized her. He was an extremely fast subject in hypnosis and she quickly improved and my birth was induced with hypnosis. In other words, it's been a lifetime, right? And mysteriously.
A lifetime, literally, right?
At 10 years old, I got interested in the subject, 11 like that, reading spontaneously. At 12, I think I bought my first hypnosis book. And at 13, I went to study parapsychology, and I also learned how to hypnotize because the person also knew how. Me, at 14 years old, I was doing regression, including several people at the same time, and I never stopped, right? And then I started specializing more in the hypnosis thing, I consider. I became a clinical psychologist, master trainer in neuro-linguistic programming, hypnosis, coaching. I teach courses here outside of Brazil. I've already given a course in Portugal, already lectured courses in China, England, the United States, in various places. And I love doing it. I adore it. I have a YouTube channel. It's 19 years old. It's one of the oldest YouTube channels in the world.
More than 3,000 videos, right?
Yes, there's a lot. 3,000 videos, I think, is the official count, because I think there's much more than that there.
And I never stopped, because I think, Mateus, that we're living in a time, really, a period, where this kind of knowledge that we develop, regardless of whether it's traditional or not, is truly important, because it manages to solve the challenges that people experience in a fast, effective way. And so today, well, I'm a clinical psychologist. Clinical psychology is very important to me, but I work predominantly with neuro-linguistic programming, which is also a psychology. Many people don't know that. NLP is a psychological field today, although some people are still debating, is NLP a psychology? NLP is a psychology. If you're a therapist, it's a psychological field. If you just want to use it, just like psychology itself, it's used in training, it's used in other things. I might not be a psychotherapist, but use psychology in training. But NLP is also a psychological field, and I use NLP combined with everything I do. Because to this day, I don't know anything more effective in my map than neuro-linguistic programming to help people. And I think its combination with hypnosis is perfect, because hypnosis gives you a wonderful state, and NLP gives you a change in structure that many people...
And we see that happening in practice. Exactly. And both you and I, we see this happening in practice, right? With every patient that comes through, the integration of it, right? As you said, it's very interesting. We're always adding this kind of knowledge, because I still see that people, they're very stuck there. To old therapy still, the issue of constellation, the issue of just CBT, psychoanalysis. So it's very good that we can be expanding a little bit on this. Right here in my city, since it's a small city, I have this very beautiful work of expanding, right? I think until I started working here, nobody even knew what it was, hypnosis. Right? And of course, it's both my mission and that of those who work with both NLP and hypnosis to make it simpler so that people really understand that it's a wonderful tool.
And there's a lot of prejudice, too, about this hypnosis story, largely because of stage hypnosis and other things like that. So many people think that hypnosis is something dangerous, something that deals with occult forces.
Exactly.
And it's nothing. It's a process of introspection where you access internal resources. And we enter hypnotic states every day.
Several times a day, right? No, and that's besides the fact that today hypnotherapy is within the Federal Council of Psychology, within the Federal Council of Medicine, right? And even so, there's still this prejudice, right? But whoever is willing to allow themselves to at least understand a little bit is convinced, right? Through the therapy script itself and going through the process, the person becomes, right, a witness to what is incredible. Well, I'm going to introduce myself here quickly, because I imagine you're going to pass it on to your audience too. I'm Mateus Baziewicz. I've been a hypnotherapist for a while now. Currently, I'm doing more training. I'm a student of Andres in one of his courses, the practitioner, and also the masters in NLP. And basically, I'm one of the only specialists in Latin America in Paruresis, which is basically Shybladders, having trouble urinating near other people. So today I see people from Switzerland, Germany, Italy, the United States, not just from abroad, but here in Brazil too, being one of the only global references on this subject, precisely because I dedicated a good part of my life to studying this, because I lived with this dynamic for over 5 years of my life. I already tried back then, around 2016, I tried CBT, I tried medication, I tried psychiatry, you name it. Every kind of therapy, where my own psychologist at the time said, Mateus, you need a hypnotherapist. At that time, I said, what is that? I said, I don't really believe in those things. And then I started researching. She said, no, it's a natural thing, something that can benefit you. I ended up getting frustrated with the first professional I went to, because he really wasn't that professional. I ended up being a bit closed off about it and ended up going online. And then I found some online therapists like Lucas Naves, Andre Persia, and I basically started taking my own process through what was available online. It was through hypnosis there in just a few steps. That a problem that was ruining my whole life. I'd already been locked away for 3 years, pacing my room, doing nothing, not leaving the house. I lost all my relationships with people, friendships, everything. I locked myself away because those who don't live it don't really understand this process. But not being able to urinate outside the house or having difficulty in your own home is truly torturous. So I treated myself through hypnotherapy. I didn't even know it at the time, but also with NLP. So I started studying to see how I could use this on other people. And today my treatment is more than validated. Today I'm the author of a scientific study. I'm in submission now on this subject. And within my treatment, of course, we can't escape it. We have parts of CBT, even though I'm not a psychologist, we have very large parts of hypnotherapy along with NLP. The result is excellent, excellent. So today, for those who suffer from this, in my treatment, it usually takes between 3 and 4 sessions, most patients. So it's very, very, very fast. Well, Andre is here today because he's working with me on 2 specific cases that went a bit outside the norm of my treatment for most patients. And in this live stream, you'll be able to get a second perspective. This even opened a window for Andre and me to get a bit closer. And so that you, my followers who've been following me for a while, could see another way of looking at this problem. Of course, I'm a specialist in the subject, that counts for a lot, but Andre has a vast background in all the possible things he's worked on. And especially now with his perspective, looking at these 2 patients of mine, of course, they're just 2 patients, but I imagine Andre has already managed to get a clear view of this. I wanted to start by asking Andre something I'm curious about. And before these 2 paruresis patients of mine, had you ever treated any other patient in your life who had this same serious problem like this?
Not specifically this one, but honestly, I think it's really cool that you're asking me that, because my work with neurolinguistic programming, often called NLP, makes me take an approach that's more or less like this. You see, NLP teaches us that everything you can't actually put in a shopping cart, meaning anything that's not a physical object you can pick up and buy, is what we call a nominalization. So in other words, if you can't literally place it in a cart at the store, it's probably a nominalization, at least according to NLP. So when you give names to conditions and disorders that people have, you can't put that in a shopping cart. You have to put the person's bladder. You can't put the problem. That's a nominalization. So why did NLP catch my attention? And why can't I do anything else? Because NLP doesn't go much, it doesn't really start its work. Of course, we're interested in what's happening, but it's more like this. How is the person having this experience? Most of my colleagues, when, for example, a person says, I'm anxious, my colleagues say, I never say that. I ask, what is that? Most people think I'm joking, or else some have joked, aren't you a psychologist? I said, I am. I can give you several definitions of what anxiety is, but I want to know what that is for you. Why? Because NLP,
it materializes it, right?
Yeah. It has to understand how the person represents whatever it is. So everything that has a psychological component, you have to see the physical side of it. Whenever a person shows up with something involving the physical, I don't go forward if the person doesn't show me they've been to, for example, urologists or cardiologists, depending on the condition the person has. So I want to know if there's a physical counterpart, because sometimes there's a physical thing there. I've already treated many people too who say, oh, it's all psychological. No, the person
had difficulty
with erections. He had difficulty with erections because he was taking a medicine that produced a lot of prolactin. So that was getting in the way. Besides having psychological components, there was a physiological component too. But in general, in NLP, we want to know how the person does what they do. That's how NLP started, modeling the excellence of great therapists. Virginia Satir, Milton Erickson, Fritz Perls. So when a person tells me about a problem like paruresis or anything else, I'm much less concerned with the name and much more attentive to how you experience it. I even joke with the person. I even say, if I wanted to have this problem, how would I have to do it? Just like you? If I wanted to have trouble going to the bathroom and worry about it, I'm not. But I want you to teach me how to be worried the way you are.
And the therapeutic work is already in that. Despite appearing to be a simple question, the therapeutic work is at the core of these questions.
It's self-modeling, right? Because the person themselves starts to realize things they might never have stopped to think about. But the person has the problem, yet they never stop to think, right, about the sequence of things. That matters in NLP. Why do many NLP techniques work, like curing phobias and other things like that? Because you stop thinking about the phobia in the same sequence that you, without realizing, keep playing out. And the problem, paruresis, whatever is anxiety, any name, you name it, right? Whatever name you want to give it. The person, as much as they say they think differently, they don't think differently. They follow patterns that are more or less the same. And NLP helps you realize first, when I ask if I wanted to have anxiety like you or paruresis like you or whatever it is like you, what would I have to do? Then the person starts telling me how they do that, right? Then they start to be surprised. As you said, this is already part of the therapeutic intervention. They start to realize how they sequence things. And sometimes changes in that sequence, cognitive behavioral psychology taught this a long time ago, right? So sometimes by changing things, the sequence of things, you can make things change, but that's not everything. Another thing that's very important that I also learned in NLP is working with positive intentions. NLP has as one of its presuppositions or fundamental beliefs that behind every behavior and attitude, there is a positive intention. What does that mean? Oh, but there's nothing positive, Andre. I didn't say that. Positive intention is having a part of you that at some point learned to do something to satisfy an important value, right? So what I saw, for example, in cases like this, right, of this condition, I saw that often some of these physical effects, right, and other issues were a byproduct of something the person had learned. They learned somehow that they should, I don't know, restrain themselves in front of people. They learned that they internalized that they were worth less than others, and therefore they had to twist themselves to meet people's wishes. This generalized to the point of them becoming vigilant about the bathroom or with anxiety or with anything else. It's like that. So we try to identify what this internal part thinks it's doing for the person by maintaining that there. And find other ways for these important things to be resolved other than through that sequence of learned symptoms. So this is a hypersimplification, as it's much more than that, of what neurolinguistic programming does. And NLP, especially if you consider the Dilts line within NLP as well, with the neurological levels, within those neurological levels, you work with all psychologies. You have the neurological levels, which are various ways that you function, each having a different neurological complexity. So you have environment, behavior, and capability. You have cognitive behavioral psychology. Then you have identity, beliefs, and values. You have everything from psychoanalysis and such, which deals with feelings, emotions, and so on. And then you have beyond identity, mission, vision. You enter existential psychology, for example. And beyond identity, you even have transpersonal psychology, which the fourth generation considers connecting with a larger field and such. So through NLP, I work simultaneously in an integrated way because I think that, for example, just CBT sometimes works on one part but doesn't work on another. Only lines like psychoanalysis and others work a lot on emotions and feelings, but there's no way to do it, to bring that into practice and so on.
Exactly.
I think NLP is fantastic because I can work on all these dimensions at the same time.
Including hypnosis within NLP, right?
Yes, that's right. Actually, NLP is essentially a derivation of several different therapeutic lines, including, for example, Ericksonian hypnosis.
Milton Erickson, the renowned psychiatrist.
Yes, a large part of. I also provide training in hypnosis, international ones too, practitioner, master in hypnosis, and so on. Even someone recently contacted me saying, I can't use the name master in hypnosis because he registered it. I said, dear, you're going to fight with all of Brazil, with the whole world. Because nobody registers the name clinical hypnosis. What do you mean? What do you mean? It's as if I wanted to register psychology too.
Yes, exactly. That's right.
So I teach hypnosis, and we teach that the beliefs Milton Erickson had about how we function ended up being a big part of neurolinguistic programming. And so it's part of the process. Because when you relax even a little bit, you already open your mind more than 200 times to suggestions and changes. And some people think, will I go into a deep trance? Erickson himself, who is one of the greatest hypnotherapists of all time, used to say that deep trance doesn't even need to be a trance, actually. That hypnotic language itself and such, it's already enough to bring things out.
The hard part is taking the person out of the very trance they're in while facing that problem, right?
Exactly. I see two axes like this. One axis is the trance axis, which can be non-existent if that even exists. Small, light, strong, etc. And you have Ericksonian hypnotic language. Now, excuse the traditional hypnologists, but that's where I think Ericksonian hypnosis, which even derived into NLP, and NLP continued this, touches the structure. So I think that just giving suggestions, sometimes you clash with people's maps. But when you use an Ericksonian approach, the Ericksonian approach, instead of you saying, do this, don't do that, it involves you in a chat, in a telling of metaphors, but at the same time, and makes you want to build your change without me saying, I want you to do it. Because sometimes when you start giving too many commands, the person gets defensive. But when you use Ericksonian hypnosis, it's non-invasive. So the person themselves feels like they're changing. You listen to that Ericksonian recording, it can be used for infinite different things, not just for one goal. So that's why I think it's fantastic, all of this.
Perfect, perfect. Everything you mentioned there are basically the pillars, right, of my treatment. And what you mentioned there really about this direct suggestion part, it's something I try not that it's excluded from my treatment, but it's like you said, it's very delicate because the patient tends to have a resistance, right? It's like I always say, Paruresis is like a crutch, right? The body created that for some reason. So the moment you try to take that away from the patient, the body says, no, but this is how I feel safe. It's the foundation I've set. Right? So for us to work with Ericksonian hypnosis in this kind of sense, which totally removes this pressure from the patient, right? With questions, I find myself wondering about that, right? Or telling these metaphors as if they were for me while you do it for the patient, right? It's what takes away this weight and makes the patient really think about it without putting at stake that they need to change, right? So all this integration is very interesting, right? And I wanted to see from your point of view that from my case study that I just finished, that I saw that 90% of my patients who did CBT had no results regarding paruresis. Literally 90% of my patients who did the last previous treatment only with CBT, with gradual exposure, had no results. Why do you think this happened?
Look, it's like I said, I think the answer is there in that view of Robert Dilts's neurological levels, because they work on pieces of the thing and not the whole thing. Okay, so CBT works a lot on behavior, capacity, and environment. Right? When they even try to work on beliefs and such, but it's very weak. It doesn't move. It doesn't scratch that properly. While others too, more from the line of psychoanalysis, of psychodynamics, they work more on what are you feeling? What are the emotions? What are you feeling? But it doesn't work on how to take steps in the direction of a change. Right? Because there's a time when you have to go down to behavior, environment, and capacities to effectively promote change. Or sometimes you have to go up to the existential level and connect with existential values that justify you living, moving forward purpose, because that's the great motivator for anything. So these things sometimes don't talk to each other. That's why I think many of these therapies fail, in my point of view, working with the model that I believe works. All of that. I also see many people, and I always have, who come to me disappointed with traditional therapies, right? Years of psychoanalysis. And it's very funny, right? Because sometimes I get people like, I saw someone who spent 25 years in a deep depression, not leaving the house, developed almost an agoraphobia, had to work at a job agency near home because he had a phobia of tunnels, a phobia of everything. So this person had resigned themselves that their life was over, right? And the family called me, the wife called me, he's been like this for 25 years. I said, okay, bring him in. Like, is this supposed to impress me? And so on. In a few months, he was taking the elevator he wouldn't take. He was driving through the tunnel, and his psychiatrist freaked out when he said, I didn't come here. The psychiatrist was on the 14th floor of a tower. He said, I told you, I'm doing some work, and I want to tell you that now I can take the elevator. And I'm going to tell you this. Then the psychiatrist, that's not true. This is charlatanism. But he said like this, how can it be charlatanism if I don't feel fear anymore, right?
Yeah, sure.
Yeah, that's because he'd been in that process for 20 some years. And in about 3 months, we managed to change that. So why does this happen? Because NLP, it works directly on this structure. And I think many traditional psychologies are just a lot of blah, 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 right? I have to think about if you were attracted to your mother, if you wanted to kill your father, and then they bring in some obscure Greek myth to try to make sense of something. NLP goes straight to how neurology works, the nervous system, and everything discovered today in neuroscience, although neuroscience has no relation to NLP, much of what neuroscience alone has discovered confirms what NLP has been doing for 55 years approximately, right?
Yeah, sure.
So I think it's very much because of that, because Bandler says, who is one of the fathers of NLP, right? I do what works. I remember when I studied psychology, I heard from professors, and he later said this too, Bandler, in the courses I took with him, I did more than 10 trainings with him. And he said, and I heard this in college too, we can do 10 years of psychoanalysis on someone, and it might not solve the problem. Bandler says, what do you mean? That's not a good deal. You've invested the equivalent of a house or two, and even more so traditional psychoanalysis, you do it several times a week. It's quite expensive for it to maybe not work out. He said, I don't want a toaster that might work 34% of the time, or a space shuttle carrying human lives might work maybe 27% of the time. I want to turn on the toaster and I want it to always work as long as it's working. I want my car when I start it to always work, right? So it's in this spirit that NLP was developed. I think that's why things happen, you know. But this is very new in these things we do, right? And many people don't know.
Exactly. I don't know if it was Bandler who said that, but it's from someone in NLP there. It talks about the issue of traumas and phobias, right? How would you expect to lose a trauma, a phobia in 10 years when you learned it in 1 second, right? Basically, if you learned that so fast, why do you think it would take years for you to treat and resolve what was learned, right? So exactly, doing what works.
All therapies, one of the most important books I've read that you can read is an old book, but it's very current because it talks about very current things even today. It's called The Turning Point by Fritjof Capra. I studied this book before doing psychology. It made all the difference because it tells the story of paradigms in humanity. So it shows how the Newtonian Cartesian deterministic paradigm, it influenced all of 19th century science and medicine. And Freud was a doctor in the 19th century, right? So I don't think Freud is wrong. I think Freud was an excellent example of what was thought in the 19th century. Women had penis envy because the one in charge was the penis itself. It was the man, right? So the 19th century woman, this poor thing, she had penis envy because the penis could do everything. They could do nothing. And this deterministic view influenced. So this deterministic view is like this. You have to go into the past, dig up the past, wallow in wounds, squeeze the pain, feel the pain, and that takes time, right? I remember I've already seen people who came hidden from their traditional therapists or psychoanalysts and such. No, he can't know I'm here, right? He can't, otherwise he won't see me anymore. Okay, right? No, he said I have to suffer a lot, that sometimes it's years of suffering. And maybe even...
It's part of the process.
Yeah, years of suffering. At some point it stops. And maybe... Did you know that the average cure for deep depressions in psychoanalysis, according to Alfred Barrios, who has published studies everyone can access on the internet, is 11 years on average, with only 37% success? It's not a good deal. 11 years with 37% success.
Those who work with NLP, with hypnosis, know that, of course, we're not generalizing all cases of depression, but like what we see in the clinic, using the correct method, looking correctly at the patient, you can.
According to Alfred Barrios, who has published studies that anyone can access on the internet, it takes 11 years on average with only a 37% success rate. It's not a good deal. 11 years with a 37% success rate.
Anyone who works with NLP and hypnosis knows that, of course, we're not generalizing all cases of depression, but what we see in the clinic using the right method, looking at the patient correctly, you can treat this in a very simple way, right? By asking these questions. And it's very common for us to see as well, even with classical hypnosis.
Classical? Even classical hypnosis. It's 6 or 7 sessions on average.
According to those sessions, and there's already scientific research proving exactly that, right? Now imagine with the integration of NLP, and it's very common. Just yesterday, a new person reached out to me, right, saying she's been in depression for 15 years, and she's never done therapy before. Just like many people come to me, especially in cases of paruresis, right, Andre? These are people who have been suffering from this for 10, 20, 30. I had a patient who suffered from it for 40 years, right? So we see how something has to be done, right? So even yesterday, I did a live stream with another therapist friend of mine here, Raphael Vilepsky. He also has a very large YouTube channel. He does a lot of self-hypnosis there. It's very interesting. And he talked about this. If you've been doing the same therapy for 10 years, weekly, religiously, and you haven't achieved it, you're going to have to change. You have to do something different, right? If you plant potatoes, you're going to harvest potatoes. So if you're not getting that return, right, it's not because that's reality. You know, it's not because therapy didn't work or because the reality of psychology is like that. Not always, right? So we need to get out of this, look forward, understand a new way that you can have to treat that demand that you have, right? And today it's more than proven how much our emotional demands don't take years in most cases to be resolved, right? Often because what happened to us are very specific facts. They're usually very clear experiences in our lives that taught us to have depression, that taught us to have anxiety. Here in my clinic, you mentioned a part where you say, right, that your patients get a bit crazy, and the same thing happens here with me. When a patient of mine says they have depression, anxiety, fainting because of something, panic attacks, I exaggerate. I say that this is something truly incredible, right? Because your body found a way to communicate with you through that, right?
In other words, you already do the reframing, right?
Exactly. I always say it's incredible. Look how incredible. You had, I don't know, a car accident. You're going to get into a car now. You faint. Look how incredible. Look how incredible what your body is trying to do for you by not getting into a car again. So you see the capacity your body has to work in your favor. And that's where NLP comes in. How can you honor what's important, staying safe, but without needing to faint? Right? So we start to see how all this works. Takes a massive shortcut in all areas of treatment, whether for anxiety, whether for a phobia, whether for a trauma, and whether for paruresis, it's the same thing, right? These are ways that our body finds to protect us. It's a program, just like you often say, right? In your classes, it's a program that's installed there that has some functionality, right? So you have to understand, not that it's mandatory for the patient to understand the function of this program. It's more basically thinking about it, right? It's already part of the process, right?
Today, the Diagnostic and Statistical Manual itself, which is the DSM, which is the Bible of psychiatry, of international psychology, talks about the importance of psychoeducation too, which is some level of information about the process, right? Because these more traditional therapies, only the therapist or the analyst was the one who had the knowledge. He only said what he wanted and you got better. Good luck to you if you could. Today, there's a consensus among psychiatrists, psychologists, therapists that psychoeducation is important. In other words, it's that helping the person understand their own dynamics and the NLP processes themselves. I can speak about what I do, right? The NLP processes themselves. They already do this psychoeducation because the exercises, the NLP practices,
they stimulate that,
make you reflect on what you're doing. So you already start to have a large part of this psychoeducation because you understand with the technique itself that things were like this. I did X, Y, Z, and they turned out like that, right? So you start to connect things. And there's a very important aspect too in what I want to put here. I think it's important. We work with both hypnosis and NLP and other processes that are very important and are much faster. And we also live in a time when people, they simply no longer have 10, 15 years to do a long analysis so that maybe in 5 years you'll be better. Today, if you don't get better fast, I worked like crazy during the pandemic, right? And there I put NLP to the test. I already knew, already was familiar, already trusted it completely, but I really put NLP to the test. You remember how the chaos was, right? Everyone desperate at home, freaking out at the same time, with a lot of people dying.
Without being able to go to the therapist, right?
Insecure and with children home, everyone in the same space, sometimes confined. What we could quickly do with NLP and people really changing a galloping anxiety that was coming, among other things like that. So we today live in a world, I even think this is a bit dramatic, right? There are two aspects here. First, we live in a world that doesn't wait for you. You can no longer afford the luxury of doing 5 years of a long analysis. So that maybe in 5, perhaps 30% possibility, right, of working or not. That doesn't fly anymore.
Besides the amount invested, right?
Yeah. Second, today we need a series of soft skills or abilities that traditional education doesn't teach us. Emotional management, effective communication, self-awareness, dealing with yourself, dealing with others, among many other things which are absolutely crucial. People are being hired and fired because of this, and they don't have anywhere to learn this in traditional education. I find this very dramatic, very cruel even, because people are literally being cut or hired, people losing positions because they haven't developed skills. And these NLP processes, even in therapy, they end up developing multiple intelligences, emotional intelligence, everything that today is called multiple intelligence, emotional, we already work on in other ways. For over 50 years in NLP, with other names in another way, you see the same thing. These things are crucial elements for the world that we are living in today. So we need these skills as well that hypnosis develops, that NLP develops, and all these studies, in my opinion.
Perfect, for sure. As I mentioned about the DSM, about the medical manual, there's a movement happening for a while now, mainly by Bessel van der Kolk, who has a book of his, actually, The Body Keeps the Score, where he debates many things about the connection between the body and the mind, the traumas, right? And this movement that's happening there, even within psychiatry itself, is to change the issue of treatments a bit, because today, basically, the principle of a psychiatric treatment is medication, right? When it should be therapeutic treatment with the help of medication. So this movement is happening, and the intent there in the case of using psychotherapy as this center, changing the DSM precisely to have this understanding so that the patient gains understand what is happening to him. Something like you said, that NLP does very well, even without meaning to. NLP, it's not a theory, it is the practice. It stimulates that in the patient, unconsciously for the patient to see and understand what is happening to him. So that's very interesting.
You can also add that NLP today is being taken to academia and scientific research. On NLP is already happening with meta-analysis, including, it's very recent, but it already has a very considerable body with a very considerable meta-analysis in favor of NLP as well, grounding a large part of this practice, because it was never made to be an academic discipline. It was made to be something for you to use and live better. But this is already being taken to academia as well.
It's perfect to mention that, because when people look it up, I think NLP, even today on Google, will appear as a pseudoscience, as something that is still outside the CFP. But we have to understand that this whole process is still very new, even though NLP is old, back from the 70s, 80s, 90s, all the parts.
50 years is nothing. 50 years, it's nothing compared to the major therapeutic lines.
Exactly. So it's like you have to give it time, right? But it's clear that all of this is already showing more than proven results. And as you said, NLP isn't just for treating paruresis. It's not just for therapy, right? As I tell my patients here, generally speaking, I don't just see people with paruresis. That's 40% of my work, right? The other 60% is every possible emotional dynamic. And deep down, we're always working on the issue of excellence, right? For that person, for that patient, right? So for a patient who's anxious about something, by helping them resolve that anxiety, they'll improve in their relationships at work, in their business, and with their family, right? So we're always talking about this issue of the patient improving in every possible area. So for those watching this live, oh, but I'm not a therapist, oh, but I don't have. If you want to be better overall, to understand life better, to understand yourself better, it's more than worth taking an NLP course, right? And I recommend, Andre's course. So it's for everything in life. It's about excellence, being a better son, a better father, a better businessman, a better employee, a better collaborator. Overall, NLP works exactly on this issue of excellence, right? And it's even very useful when it comes to therapy. So there's really nothing bad to say, so to speak, about using NLP, because it covers so many different areas. And in my treatment for paruresis especially, right, we include various NLP communication techniques to achieve the expected result, right? Something you mentioned there about the issue of beliefs, right? And I'd like to get your perspective on this and also share a statistic with you, right? 85% of my patients, I'm not sure if it's 85 or 95%, let me just check that for you. If I'm not mistaken, 85 or 95% of my patients, right? In this study, 95% of them have a trauma related to the bathroom, related to urination, which is closely linked to the onset of symptoms, right? So in short, most of these patients had some trauma that taught them or showed them, usually linked to the onset of symptoms, which led to paruresis. What kind of beliefs do you think a trauma like that regarding urination, or maybe someone who sexual abuse is also very prevalent in my studies, right? About 40% of patients had some level of sexual intimacy violated there, right? How does all of that affect their identity, the identity of these paruresis patients? What kind of beliefs do you think end up not just being installed because of a trauma like that, but also what kind of beliefs do you think the person might already have had, let's say, beforehand, that made it easier for a problem like paruresis to end up flourishing, so to speak, in the patient?
How do beliefs work, right? We live life creating meanings, what NLP calls the map, right? The map. The map is the set of references, meanings, things that you internalize within yourself. And one of the things you define are values, the things that are important to you. Whether because you learned it, because you absorbed it from family, from other places. So at some point, there are several things that are important. And then we go out into the world trying to live. And we end up going in the direction of what we consider important. When we go out into the world trying to live what's important, we have experiences. These experiences, they can be positive or negative. If you, for example, want to be happy, want to be well with yourself, and you reap positive experiences, then most likely you tend to develop at first a high self-esteem, self-confidence, and a series of other things like that. You develop this positive belief. What are positive beliefs? It's when you believe this is possible. I am capable because I can do something about what is possible, and I deserve this result, right? And the negative belief is when you go out into the world trying to be consistent with your values and you don't reap positive experiences. So you start to associate, for example, you mentioned identity, right? I am a problem because when I'm around, people fight with me, or when I'm around, people violate me, or when I'm around, I don't know, I'm there. So the person, they reap so much and they start to associate that with identity. I've seen several cases where, for example, any symptom like paruresis or any other comes, for example, from a weak identity. In the sense of the person, they learn to develop low confidence. Why? Repeatedly feeling inferior, sometimes having financial problems involving the family, comparison with other children who had money. And then this feeling of worthlessness was never worked on. So parents, talk to your children. Your children don't know how to express this to you. Pay attention. If you feel the child is freezing up, etc., I follow someone very close in my family who had a paruresis problem and even did some work with CBT. It wasn't that complicated. And a few CBT sessions already helped a lot. So waiting a long time. We were at an amusement park and all. And we're not moving because he can't go into an enclosed place. He didn't even have a problem going into an enclosed place, but he couldn't do it there at the urinal along with everyone else. So this often comes from what you pick up. So a limiting belief is a sense that it's not possible for anyone, or else it's possible, but I don't feel capable, or else I don't deserve it, which rarely appears in that way. I don't deserve it. It usually appears more like this, like, oh, this isn't for me. No, I don't think it's for me. No, this is for other people, which is even worse. I think it's even more pernicious. So you start developing beliefs. I'm not a total believer that we always have to hunt for a trauma, because not every problem comes from traumas. Many problems, they come from the constant dripping that wears away the stone. So sometimes the repetition of patterns, for example, following a case of paruresis that I saw, the person for years felt a sense of worthlessness and low self-esteem. And this was never discussed because of the culture, the geographic location where they lived, where people don't open up as much, a smaller place, and so on. So this person was never questioned about it. They kept it to themselves. So this feeling of worthlessness grew and grew and grew. In other words, a limiting belief. In other words, it's not possible for me to feel like others. I don't feel capable like others feel. And maybe I, being this way, don't deserve it. It's not exactly in those words, but that was being developed. So I think that often there is trauma, but it's not always trauma. Often problems, physical symptoms of emotional origin also come because of patterns that you repeat and don't change. And where you put your focus, it grows. NLP teaches that. So people, they continue processes, it grows and grows and grows and grows, right? We tend to repeat patterns. Everything in us, we are machines of pattern repetition. So many people continue smoking, knowing it's bad, they continue destroying themselves, knowing that it's bad. It's written, you buy the cigarette, it's written, this kills you when you keep using it. Why? Because you learn to satisfy things through that, even though that doesn't help you at all with security, with introspection. You don't need any of that. You don't need any of this, but it helps. Sometimes I think trauma helps, and other times trauma is combined to or without trauma, but a pattern comes, something that keeps repeating and is never questioned. So that which is not questioned is reinforced. So I think there are these two sides to the thing.
Perfect. I always explain to patients, right? Sometimes within our initial anamnesis consultation there's one patient or another that we can't find anything expressive there. That anyway might have triggered it. And I say that there's no problem at all, right? We don't need to hunt.
I learned that from NLP. It really hit me, because we're also trained
a breakdown of ideas, right?
To have to look for a cause in everything. And I learned that from the beginning of NLP. In fact, Bandler says this, everything has a cause. And that's not even slightly important sometimes, right? Because
no, that's definitely for sure, right?
The past, it is present in your symptom. I don't always need to know the past for it to be present so I can work with it. I work with the past.
The structure is happening there at all times.
When I neurolinguistically dismantle a limiting pattern, sometimes I don't know when it started. The person gets rid of it sometimes without knowing how it started. Because the past is present in the symptom. Other times the person knows. If it were true that knowing the past solved it, lots of people who know the day they were violated or suffered violence and such, all of them would have cured their problems. Because they know the day, the hour, the moment the thing happened, exactly how it was in every detail. Sometimes it keeps coming back. She knows all the details. But that's not enough for the person to change. So there's this myth too, right, that you always have to go back to the past, poke the wound, what I said about the Cartesian view, that you have to go back to the past, that the past, it influences the future, right? In some cases, it can be very useful. There are NLP techniques for this, like re-imprinting, other techniques too. Timeline work, changing personal history. When the perception of the past is important, I have a principle that I learned from NLP. Something Bandler also always said, don't make the client look for their wallet where they didn't lose it. So like when the client, he has a demand about the past, I work on the past. When the client, he doesn't have a demand about the past. If it comes up, I work on it. If it doesn't come up, I dismantle whatever has an origin in the past through neurolinguistic processes that dismantle that, regardless of me knowing exactly what the past is. What I've seen many times are people fabricating doubtful pasts of things they're not sure happened to fit into psychoanalytic theory, and among other things. I've seen this so much. So much. I think I was violated. Do you have the memory? No. Is there any proof, any evidence? No. But I think I was. Because the psychoanalyst says that's what could have happened. Maybe it happened.
It's the most likely, right?
But I think it's reckless to assume things like that without having evidence. You don't need that.
Exactly. And then when the therapist isn't ready, right, to deal with this, imagine if the therapist only goes down that line, right? I need to find the traumatic root, so to speak.
Got to find the cause.
Then there isn't one. What's he going to do? So NLP is there.
I've seen this so much already, with so much fabrication of causes. I want to say something too that I think is very important for any symptom. I've been practicing for over 35 years, okay? Even before becoming a psychologist, even longer. I do hypnosis on people. For about 40 years, I've been doing hypnosis on people. There's a trend in current times that worries me a lot. I am seeing many people who are resigned to their diagnoses lately, Many diagnoses have appeared, some that even give you rights to benefits and such. I don't see any problem with you having a diagnosis, having a benefit that the government gives you, that the state gives you. I think that you should go after that benefit and enjoy what you have a right to, okay? But I am seeing many people stop trying to solve their things just to keep on introducing themselves. I am this, I am that thing.
And that's exactly what that book I mentioned to you, the body keeps the score. it addresses, right? Because we see a lot of problems. I don't know if it happens to you in your clinic, most likely, but people come here to me and say, Mateus, I'm borderline. Mateus, I'm bipolar.
That is it. That is exactly what you are saying. Oh, I have ADHD. I said, nice to meet you, Andre Perez, right? Then the person says, I have ADHD. I say, what is that to you? They want to die. They want to jump out the window, right? Because these names, these acronyms, I know what they are. I have a course on my platform just about these psychological disorders, especially since there are many therapists who didn't have training in psychology or psychiatry. So I recorded it in a much simpler way, and all the main psychological disorders and such, I know all of them, right? That is not the point. The point is that I don't get stuck on names. When someone says, I have ADHD, I have whatever it may be, I don't say, I ask them, what is that? How is it that you live? How is it that this happens to you? Because that's what I want to know. And then you return the nominalization. Just to finish, when we return the nominalization to the process, you can change the process. When someone says, I have anxiety, I ask, what is anxiety like for you? And the person starts telling me what they do. They discover they can undo that or do it another way. So you return, according to the NLP tradition, the nominalization to the process, which is where you try to change.
Exactly. I have, let's say, a certain ease in talking about this because back in 2015, 2016, Mateus, was diagnosed with fibromyalgia, Andre, by 3 doctors. And that thing became my identity. Even today, I leave my old profile open on Instagram at Mateus Archives, where there are several posts from that time about how I saw myself as someone who has fibromyalgia. So I lived this false identity that they put on me. Today, I don't have any symptoms of fibromyalgia, and I was diagnosed by 3 doctors from different cities, right, at that time with that. And that became my identity. I had that, I lived that, and it seems that the more I fed off that identity, the more I had it, right? So I always use that even within my treatment for paruresis, right? You're not a person who has paruresis because you can't put it in the shopping cart, right? You still experience that. It's a way you found. It's a name we give to a set of things you feel, right? So that's very interesting, and I work a lot with that. It's a bit delicate because usually some patients who come with this identity, they don't want to let go of that identity, right? Because it offers some kind of benefit.
The person forged that identity because often, as I said, things are structural. They come from old learned things where the last symptom in line is paruresis or anxiety or whatever, right? So they ended up becoming adults with that already as part of their identity. And it's what I call the positive intentions of NLP, right? In other words, a part of them even learned to be that, right? So it's that old story. We stick with what is familiar. Even though you know there are other things, the familiar, you know how to navigate that no matter how bad it is. You didn't choose this on purpose. No, you learned it. So that's also why I talk about these diagnoses where I see many people settling into a diagnosis. Please, if there's one thing I want you to take from this live stream, among many important things we're saying, it's don't get comfortable with these terms, these acronyms, these diagnoses. It's just a name. You need to be curious about what I do so that I can first understand how I do what I do and then ask, what would it be like if I did it differently in another way?
Perfect. Right? You mentioned that issue of traumas, right? And in a general way, yeah, and really if a trauma might even exist, but trauma is only trauma when there's a favorable scenario. You had mentioned that part about the child ending up taking everything on themselves and developing this identity of worthlessness, of low self-esteem. And just to be clear for those watching us, as I imagine some people might wonder, but why would a child think that, right? Why would a child take everything personally?
It's the developmental stage.
Exactly. And here there's a great, I don't know if you've met him, probably yes, Dr. Gabor Mate, right? A very renowned doctor, a trauma specialist. And there's something very interesting that he says, and that explains a little bit about this, that it's much more viable for the child, right? When they're living in this environment that's totally dysfunctional for them, whether it's parents who can't deal with them, can't help them, or there's no affection, no care, no attention, nothing there amidst these negative experiences. At least the child taking the blame themselves is what gives a sense of control, right? That if they try very hard, maybe something will change, right?
Yes.
So they have these two perceptions. Either they think the whole world is ruined and, well, everything is bad. You know, they think the problem is them. So it's much more plausible for a child who doesn't have that emotional management. And obviously they don't because they don't have the resources for it, right? for them to end up taking everything personally. And remember, everyone, the child isn't going to think this consciously, oh, I'm bad, oh, I'm evil. But this happens in the deeper patterns in that child's unconscious. So that's why when this scenario exists, it's not just a trauma that will trigger paruresis, trigger a phobia or something. There's always a favorable scenario for that to grow, for that to develop, right? I always tell my patients it's multifactorial. It's not just one trauma. It's not just one negative experience, but the whole context that will amplify that this one day. And then becomes this identity, becomes the problem, and becomes the symptom down the road. So it's important for us to also differentiate this and explain to people why this childhood issue is very important in human development, in the matter of emotional management.
Each stage of development has specific characteristics. All child development, if you study developmental psychology, in a general way, the child is very centered on themselves. In different ways, from a small child to a teenager, preteen, the world revolves a lot around the child in a general way. It's forming, so things work very much like that. So everything revolves, so much so that it's very common, for example, when couples separate, they have children, for children to develop the fantasy that something they did led to the parents' separation. It's not a conscious decision, but it's because it's part of these stages of child development, of the teenager, preteen, in several different degrees, depending on the stage. The child is very centered on themselves, very much on themselves. You only really start to decenter there after 20 years of age, when you start to really truly empathize with the other. Because before you simulate it, but the child, the teenager, the preteen, the teenager is very centered on themselves. So everything revolves around the child themselves, the teenager, the preteen.
Perfect. Well, you're a psychologist by training. Besides having master training in hypnosis, NLP, one very interesting thing, which is even being debated in this clinical study, my case study, is the difference between paruresis and a social phobia. So in this study, due to all these episodes, it's very clear that in all the patients I analyzed, the trauma that happened to them had a lot to do with the onset of symptoms, which later, returning to that attention, then in the midst of this sphere, this atmosphere that he was included in there, that made that happen, triggered in the future through other triggers, paruresis. But basically I was able to notice that it differs a lot in terms of generalized social phobia, which is what today's current CBT ends up looking at. In those cases, you handled there of paruresis,